Welcome to Desert Living, where we connect you with everything that makes the Coachella Valley a wonderful place to live. Desert Living starts now. Here's Brian Gallo.
Well, Desert Living viewers definitely know this face right here. I'm joined with Dr. Raj Sinha at Star Orthopaedic. We're actually on his turf. We're not in the studio. How are you?
I'm great. How are you?
I'm doing great. Thank you for having us.
Thanks for coming out.
Yeah, nice to see you. So we're going to talk about some pain today, correct?
That's correct.
All right. Well, besides arthritis, what are the common causes of knee pain?
Well, you know, the patient population that we see out here is mostly middle-aged patients. And so arthritis is by far the most common thing. But there are other things that go on in the knee, the most common of which is a torn meniscus cartilage. So the meniscus is a C-shaped type of cartilage that we have in our knee. And we have two of them, one on the inner side, one on the outer side.
Okay.
And you typically hear about athletes getting a torn meniscus from a specific injury, often associated with a ligament injury. But as we get older, you see degeneration of the meniscus and a relatively minor trauma, like sleeping on it funny, tripping and falling, stumbling.
Small stuff.
Small stuff can get it to be torn. And then when that happens, especially if you have arthritis on top of that, now you've got two sources of pain in the knee, and it becomes very difficult to tease out what's actually causing the problem. And then oftentimes, doctors will treat one over the other and not get the whole thing taken care of.
I see. So then what are some treatment options?
Well, the good news is that for most meniscal injuries, especially the degenerative type, you rarely need surgery. Most of the treatment options that work are things like cortisone injections, anti-inflammatory pills, and physical therapy. And for most of the degenerative type of tears that we see, if the patients can wait long enough and sort of wait out the symptoms, they can probably avoid surgery. Now, how long do you have to wait? It could be months.
That's the key.
Until it finally settles down, and that's where the treatments with the cortisone and the anti-inflammatory pills and the physical therapy come in to try to buy the patient time to see if we can avoid the surgery.
Do you find that some surgeons are quick to diagnose surgery instead of taking those other options you just mentioned?
Yeah, the thing that I see very frequently that frustrates me a little bit is exactly the situation I was talking about. The patient has some underlying arthritis. They have a torn meniscus on top of it. Somebody orders an MRI. It shows the torn meniscus, and immediately they're off to surgery getting an arthroscopic procedure to go in and clean up the torn meniscus. And although the arthroscopic procedure is pretty reliable for cleaning up the torn meniscus, unless you factor in what's going on with the knee, especially the arthritis, then patients can be very disappointed that, hey, I went in for the surgery and I'm not any better. And that's because we have to take care of all the other issues that are going on in the knee.
Not a win-win. So speaking of MRI, what is this cool device that's sitting behind you?
So this is actually our room where we do X-ray in real time. This is called a fluoroscopy unit. So we can put the patient's body part between these two pieces here. The bed that you're sitting on.
Oh, I see. This will roll up.
It rolls underneath the bed. This bed goes up and down. So for example, if we're looking at a hip, which is the image that's actually on the screen right there. That's somebody that I actually injected their hip with cortisone for arthritis. So that's the needle rolling in there, and the image confirms that I'm inside the hip joint.
Looks like you had to go pretty deep on that.
Well, the hip's all the way down.
There's nowhere else to get to.
It's as far as it goes. So we will often use this to, we get x-rays for most of our patients, but they're static x-rays, and they don't always tell the story. So if something's not quite jiving between what the x-ray shows and what the examination is showing, we'll bring them in here, fire up the machine, and in real time we can watch as the joint is moving, what the ligament stability is, things like that. So it really helps us with diagnosis. It really helps me with total knee replacements. If they're wobbly and unstable, I can get a quick sense of where the problem lies.
And as far as the future of what you do, is this all new equipment? Is this?
Well, this is fairly typical equipment for real-time X-ray imaging. In terms of what we're doing with the customized knee replacements and things like that, that's all CAT scan based, and the devices and the tools are actually 3D printed.
Very cool. Well, I appreciate you bringing us into your space and letting us check out these really cool toys. Well, Dr. Sinha's office is located in Rancho Mirage. Bob Hope, right by the Gelsons. You cannot miss it. Check out his website. Star Orthopedic, what is your website?
Yeah, starortho.com.
There we go, starortho.com. You can find all his information there, as well as his phone number. These are things I should know by heart. It's many times I've interviewed you. I should have your websites burned in my memory.
You're busy.
Well, I appreciate you having us here.
Thanks so much for coming.
Thank you, Doc, and we'll see you all after the break.